I'm on the faculty at Institute for Functional Medicine, and I remember going to one of Bob Roundtree's talks and really learning for the very first time the difference between a toxicant and a toxin. So maybe you can actually define that for our folks that are listening and saying toxicant. That's not really a word that I've heard before.
So those would be low-level chronic burdens that you experience over time, things that aren't going to cause you overt poisoning, right? But low levels of toxins. Oh.
Keep going.
So low levels of a chronic exposure, and those toxins, they end up in our cells, in our fat cells, or in the cells of our organs, and they're not typically found on blood tests, although often lately I am finding them on blood tests even. So that's what environmental toxicant is.
Okay.
Yeah.
There's also a difference between a man-made compound and one that comes from nature, right? Like a viral tick-borne
Yes
versus BPA, right?
Exactly. Yeah. So I test for those. So there's toxins that come from mold. Those are called mycotoxins. And most of my patients have a very high toxic burden of mycotoxins, in addition to the man-made chemicals, for instance, perchlorate or glyphosate. Yeah.
Right. And we are a little bit like, I talked to Roger Murphy a little while ago, and we were just talking about the boiling frog scenario or the canary in the coal mine. And I realized I just sort of rattled those analogies out, and people may not know what I'm talking about. You know, the coal miners used to bring a canary in a cage down into the mines, and if the canary died, that meant there were too many fumes in the air and that they needed to actually get out of the shaft. And so the canary is the one that shows everyone else that there's a problem, right? And that's most, it sounds like, of your clients and mine, are ones that would be considered multiply chemically sensitive or sensitive, period, you know, and consider themselves to be very, very fragile, because that's what they've noticed about themselves. Like their bodies and their genetics, their detoxification systems are maybe not as robust as another person's, right?
Exactly. Yeah. And I measure their genes of detoxification. Actually, I'm using a new test where I can look at the genes, the SNPs, and all the different systems of the body, and how those genes are interplaying with one another, which is really, really helpful in these misery illnesses.
It really is. And I'm glad you mentioned that, because I do genetic testing on 100% of my patients. And the reason for that is sometimes they're anxious about it. You know, you're going to tell me that I have da 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 da, or I'm going to get cancer. And that's not it. It's looking at what you're just saying, at the interrelationship between the different single nucleotide polymorphisms and the different parts of your body. And it's actually getting an explanation. I call it the X marks the spot on a pirate's treasure map, right? Like,
yeah,
dig a little deeper. This is probably a place where your genetics are showing us there could be a challenge. So let's do some of this testing that has to do with the SNP and dig a little bit deeper. And I think people look at genetic testing as the final end all be all, but we never treat the SNP, right? Where we have to actually see, like, is that really true for you?
Exactly. Yeah. So I'm looking at the SNPs, and then I'm looking at the toxicants and saying, okay, look, there is a match. Right. Usually there is. Almost 95% of the time there's a match between what I'm seeing on the genes and what I'm seeing in the biochemistry in their body. And then they're relieved to see this. Actually, they say, finally, I have a diagnosis, or finally, I understand why this is happening to me.
I get people crying all the time when we practice, yeah. Right? It's like, I'm not crazy.
Exactly. Yeah. I can actually tell my family I'm not just lazy.
Right.
Or crazy.
Right.
Yeah.